Good, happy Tuesday afternoon, November 17, 2020. I'm Riley King, and welcome to the Riley King Newscast, right here on the Riley King Network. We have a lot of news to get to this Tuesday afternoon, so let's begin. First up, we're going to begin with coronavirus in New Hampshire, key information and data. Let's take a look at that right now. And here is a look at that information for all of you right now. There are 15,029 number of people in New Hampshire have tested positive for COVID-19. 11,172,779 number of people in the United States have tested positive. 500 number of deaths from COVID-19 in New Hampshire. 817 number of people who have been hospitalized with COVID-19 in New Hampshire. And 247,019 number of deaths from COVID-19 in the United States. Now let's take a look at this map of New Hampshire where current cases of COVID-19 are. Manchester, 378. Let's take a look at this map of New Hampshire where total cases of COVID-19 are. Manchester, 228,67. And now let's take a look at these three charts here. Let's start with the first chart here. New cases each day in New Hampshire in the purple. Daily new positive COVID-19 cases in the orange. New hospitalization in red, deaths. Let's take a look at this chart here. Current cases in the purple. Total current COVID-19 cases. And in the orange, current hospitalization. Now let's take a look at this chart here. Total cases in the purple, total positive COVID-19 cases. In the orange, total hospitalization, red deaths, and blue recovered. Now let's take a look at this chart here. Positive PCR test rate and daily PCR test. And let's take a look at this chart here. Each group of cases, female and male of cases, and risk information. And let's take a look at this chart here. Infections, hospitalizations, and deaths. And let's take a look at this chart here. Deaths, percent of New Hampshire population, race/ethnicity of cases, and hospitalizations. And a reminder, your common symptoms: fever, lack of smell, cough, chills, difficult breathing, nausea, vomiting, diarrhea. How it spreads, and prevention tips. And be sure to stay with the Riley King Network for the latest of your COVID-19 information. Health officials warn of possible COVID-19 exposure at Wolfboro Church and Salem Casino. 25 known cases connected with church in Wolfboro, officials say. New Hampshire health officials are warning of 2 possible COVID-19 community exposures at a church in Wolfboro and a casino in Salem. Health officials said 25 people with COVID-19 have been linked to Calvier Wolfboro Church at 43 Mill Street in Wolfboro. Officials said people who attended the 9 a.m. and 11:30 a.m. service on November 1st might have been exposed. Officials said people who visited Chaser Poker Room and Casino at 7 Veterans Memorial Parkway in Salem may have been exposed to confirmed cases of COVID-19. Possible exposures might have occurred at the casino from November 4th through the 7th and November 9th through November 12th. Health officials said. Officials with the Department of Health and Human Services said contact investigations have been conducted and known close contacts have been notified directly, but they said there might have been other people exposed who can't be identified. COVID-19 cases have increased dramatically in New Hampshire over the past few weeks. Officials have been urging Granite Staters to continue to take precautions, including wearing a face mask and avoid indoor gatherings. The warnings come as people are preparing for the holidays that typically involve getting together with family, but health officials are urging people to keep gatherings small and ideally limit them to people in the same household. Increase in COVID-19 cases in Durham could be linked to
Fall home improvement season is taking off at Bell-Tate's Building Supply. From building materials to tools, paints, and everything else you need, we'll make fall home improvements a breeze. Shop online at belltates.com. Visit one of our 9 locations or place your order via phone or email.
COVID cases have more than quadrupled over the last 10 days in Durham, but UNH students aren't the only ones getting the virus, according to the town administrator. With 142 confirmed cases, he believes the rise can be tied to Halloween gatherings, but not just by students, but by community members as well.
I think this is just a really sobering reminder that getting together is a challenge in this COVID environment. It's important to maintain those protocols, the masks, social distancing.
This Friday is the last day of on-campus classes for UNH students. They will finish the semester remotely with plans to return in early February.
Okay, and there you go on that video and that report. Community spread impacting workforce, including hospital staff. Staff cases originating from outside of the workplace. Let's take a listen to that video from WMUR News 9 and Jennifer Crompton.
Hey, Paul here, owner of Century Roofing. I personally wish to thank the thousands of our customers for supporting our team. At Century, our team continues to grow, and we have recently made a major investment in equipment and personnel for our metal roofing division. Most of our competitors offer steel panels. We specialize in heavy aluminum panels that will never rust. Call today for your free estimate, 774-ROOF or CenturyRoofingNH.com.
Century Roofing, we got you covered.
Community spread is being felt at hospitals like Portsmouth Regional. Daily cases in its emergency department quadrupling recently.
What's not totally transitioning is into the hospital, which is a good thing. And so people are being discharged, not having to have an inpatient admission. But those are on the rise as well.
A concern as staff cases rise too.
In October, we had 2 employees come back positive. In November, we've had 1 per day.
Only 1 acquired at work. 15 now isolating, plus those in quarantine because of positive family members.
If we keep at this pace, and you start to think about the downstream effect of that, you may have a bed, your bed's going to end up blocked because you don't have the right patient-to-nurse ratio that you need. So that's the concern on the other side.
Another reason to fight COVID fatigue and follow guidelines, according to the state epidemiologist.
We still believe the healthcare setting, hospitals, doctors' offices can and continue to operate safely. But anybody can pick up COVID-19 in the community, especially as transmission increases. And so that's going to increase the risk to hospitals and provider offices, long-term care facilities.
We apologize for any confusion at the top of that story. Meantime, the CEO points out that we're all likely fighting to keep up the stamina while we want to spend time and engage with family and friends. This, though, a reminder that when we do so, we could be impacting workers that help keep their community safe. Live in Portsmouth, Jennifer Crompton, WMUR News 9.
Okay, and there you go on that video and that report. Ways to celebrate Thanksgiving safely and on a smaller scale this year. Thanksgiving panic, anyone? Let's take a listen to that video right now.
Outrage has been a member of Bellwether Community Credit Union since 2013. One of the other banks wasn't.
With our hospitals overcrowded and understaffed, top doctors in our state are urging people to find safer ways to celebrate over the holidays. Action 7 News reporter Brandon Evans is live in Albuquerque with some Thanksgiving safety tips.
Hey, Brittany, normally this time of year we're talking about the dangers of improperly frying a turkey or eating meat that's not all the way cooked through. Well, those dangers still do exist. This Thanksgiving, people have to keep those COVID-safe practices right at the front of their minds.
I understand how difficult it is to ask that you rethink your holiday traditions, but it is absolutely essential that we pull together to think about how we can be safe over the holidays.
This doctor from UNM Hospital says families should not be getting together as in years past.
Think about creative ways, like a Zoom dinner, or dropping off food at people's doorsteps.
She says this year there really can be too many cooks in the kitchen.
Make sure that one pod is doing the cooking and multiple families who have not been in contact with each other are not all involved with food preparation.
She says being inside at all with a group is dangerous, and if that's the case, people should wear a mask except when eating or drinking.
If you have the ability to have heaters and have your meal outside, a fire pit or outdoor heaters, that would be a safer way to celebrate Thanksgiving as well.
She says everyone should consider their families, especially those who are older and most vulnerable to the virus.
I would urge our community to think about who they want at the Thanksgiving dinner table next year as they take these decisions.
Very important point that the doctor made at the end there, saying that the decisions that we make over the next couple of months not only will impact us and our families, but could also potentially overwhelm our hospitals. We're live in Albuquerque. Brandon Evans, KWT Action 7 News.
Okay, and there you go on that video and that report. Good information there. And that does it for this afternoon edition of the Riley King Newscast, right here on the Riley King Network. Thank you for joining us for this afternoon edition, and sorry about that phone ringing in the studio and things, but things happen sometimes. Forget to turn the ringer off and stuff, but sorry about that. I hope you all have a great rest of your afternoon, everyone, and see you back here later on today for another newscast. I'll have a news report coming up in a little bit. Goodbye, everyone.